Hi, I'm Dr. Jeff Rose with Carolina TotalCare. Today we're going to talk about some common questions that we get about headaches. First of all, what causes headaches? Well, according to research, 85% of headaches are what are considered cervicogenic. Now, what that means in a less fancy term is that they originate in the upper neck. So whatever's happening in the upper neck is what's actually triggering the headache. What we actually find is that a lot of what happens in the upper neck is actually a continuation of what's going on across the shoulders or into the upper back. So therefore, it's usually a combination of muscle tightness, muscle tension across the shoulders and up into the base of the skull, but it can commonly also be brought on or certainly made worse by what's happening in the upper spinal segments of the neck. So if there are problems with the function or movement of the spinal bones in the upper part of the neck, or their position, there's irritation ultimately to the nerves in that part of the body, 85% of the time that can be responsible for contributing to or causing headaches. So what can you do about that? Well, that's where chiropractic can be a very helpful tool to helping to alleviate or solve those headache symptoms. If a chiropractor can determine that there are faults with the movement, faults with the position of the spine in that area, then oftentimes those can be improved or corrected. It typically involves an exam and very likely an x-ray study to really determine for sure what's going on and what the options are. So the bottom line is, if that's determined, the chiropractor usually can deliver soft, safe, and very effective chiropractic adjustments to help restore the normal motion, restore the normal function of those vertebrae, that area of the spine, and thus alleviate that pressure that's contributing to the headaches. You can also do things like put moist heat on that area for up to 10 or 15 minutes. That increases or improves blood flow to the area. Massage therapy, or simply getting somebody just to rub across the shoulders to address some of the tight muscle spasms or trigger spots can actually help as well. And we usually instruct our patients on a series of home exercise, home stretches, often make sure that they do know how to do some trigger point therapy work on themselves, but certainly other things like keeping enough water or hydration in your body, looking at some of the nutrition or the dietary factors there is also an important factor. But if you'd like to find out more about how you might be helped with headaches, or someone that you know has headaches, you can certainly contact the office and arrange for a no-charge consultation. Thank you for asking and wondering more about your health as it relates to headaches.